of the Aberdeenshire CPP board, and it will be recorded and subsequently published on YouTube. If you have any concerns regarding this, please make them known to Finlay. And for those attending in person and participating online, could you please make sure that your audio is muted at the appropriate times, and because the Teams meeting board microphones will capture all the sound. Also, please be aware that the use of AI-based transcription tools for recording or transcribing any part of the board meeting is not permitted. So with that, I would just ask if we can get the sediment, please, Finlay.
Okay, so I do have apologies from, bear with me 2 seconds. So I've got Councillor Neil Bailey. However, I should have Councillor Joji as substitute, Grant Moyer, Cairngorms National Park, Jacqueline Lynn, Sports Scotland, Kate Bond, Aberdeenshire Council, Nicola Anderson, Scottish Enterprise, Nicola Graham, Skills Development Scotland, Paul Finch. However, I do have Caroline Hood as a substitute, and Rebecca Hackett, Scottish Government.
Thank you very much indeed, Finlay, for that. And can I ask members of the board, please, if you have any declarations of interest? Dr. Tomlinson, please.
Thank you. By the way, I apologise, my camera seems to be playing up today, so I just won't come on. Yeah, just for item 10, it's just so that for transparency, I chair NHS Grampian's Population Health Committee, which oversees the work that's going to be discussed. But I think I can remain in the meeting, okay? It's just really for transparency.
Okay, thank you very much, John. That's very helpful. Thank you. Any other declarations? I don't see any others. So that will be recorded, John, but thank you, and you'll stay and take part in the meeting. Okay, thank you. I would also like to invite members to agree to abide by the public sector equality duty. So can we have an agreement on that as well, please?
Agreed.
Agreed. Thank you very much. And that takes us then to, sorry, I'm juggling screens here, so you have to apologise. Apologies for that. Sorry, my screen is not cooperating at all. So we'll go then to the minute, I think, Finlay, is that correct?
That is correct.
Yes, okay, thank you very much. I'll get that back. So the minute of the meeting, of the last meeting of the board has been circulated, and can I ask please that you can agree that that's a correct note? Take silence as an agreement. So are there any matters that are not on the agenda today that members wish to raise at this point? No, I don't see any indications of that either, so we can agree and approve those minutes. Thank you very much. Item 4.1 on our agenda is the action sheet, again, which has been circulated. And Finlay, are there any items on that action sheet you wish to draw to members' attention?
If you wouldn't mind, Chair, I can go through it quickly if you want.
Thank you.
So the first item, so this is page 6 of your packs. Mind your mind, first item, that's on today's agenda at item 7, so that can be moved to complete. Item 2, the further examination of the Aberdeenshire Community Justice agenda. I would ask Jason if he's got any update on that.
Yep, so good morning, Chair. Morning, afternoon, wishing my life away.
Afternoon.
So, yes, yeah, afternoon. So I've chatted to various people around this. I think there's an ability to explore that wider strategic piece with community justice social work, partnership meetings as we work through the place plans as well, as they're created and iterated on. It was discussed in a fair amount of detail within the workshops as well. So we know that operationally on the ground there is that cohesion and there is that partnership work, and I think there is good links between, for example, the area managers, local area commanders from police, and the operational bit there. So it's one that I'd look to explore as we work through place plans, because I see that those as being the bit that we coalesce around in terms of that link in with community justice as well. So that's a sort of very long-winded way of saying that bit of work is ongoing and will iterate and evolve as we work through place plans.
Okay, thank you very much indeed. Okay, Finlay.
Okay, so the third item on bottom of page 6 is the Aberdeenshire Council Housing Service Starter Packs query. That was raised on the 3rd of December. I don't know if Amanda, have you got any updates?
I can update to the extent that information has been provided to our housing colleagues to include within the starter packs, but the starter packs have not yet been fully developed. And we have rolled forward the funding to allow them to do that. And we would be hoping to get an update at our next Tackling Poverty and Inequality Strategic Partnership.
Okay, thank you.
Page 7, the streamlining CPP groups and subgroups. That was on the 3rd of December. I don't know, Jason, if you've got any updates around that.
Yeah, so that kind of linked to the item further down on the page of actions in terms of as we work through the outputs of the workshop. So we'll discuss that mapping. There was a very kind offer of Dermot helping with some of the mapping of those provision of services and third sector and public sector as well as private. So that again is ongoing work. As we work through the outcomes of the workshops, they'll be presented at the next executive, and then we'll subsequently come to the board after that with those outcomes. So mapping will be incorporated into some of those outputs, and then linked wider into the place plan creation as well. So again, it's trying to bring a number of these things together so we do it in a holistic way rather than a separated way.
Okay, thank you. Okay, Finlay.
The next one is supporting tenants with public transport access. That I think was sitting with yourself, Amanda. Oh, sorry, it's the same as previous. Sorry, I do apologise. Mapping. So item 6, mapping indicators to actions and targets in future plans. This was around indicators linking. However, I note that I've put this under, so that an update has been provided there on the 12th of February, so that item can be moved to complete, unless there is any comments at this stage.
Is it all right if I just add a comment in there, Chair, as well? So
Of
I was
course.
actually with Nicola at the and Amanda at the TPI sort of child poverty workshop day with the improvement service as well. So the outputs from that would hope that we'd link into wider LOIP refresh as well as we move into next year. So again, it's coalescing and bringing a number of these parts together in a cohesive manner as we move forward.
Okay, thank you very much, Jason. Do members have any other comments or any questions, please, on the action log? No, I don't see any. I'm going to use a tenuous link to Jason. You mentioned community justice, criminal justice, community justice. I just wonder if the executive team are cited on the commission report. There was a sentencing and penal policy commission which met, and I was at a meeting last week where there was a presentation from some of the commissioners with regard to their report and the recommendations. I just wonder if the executive are cited on that at all. Jason, are you aware of that?
I wasn't, Chair. No, but it certainly sounds like something I'd be interested to.
Yeah, I think it would be of interest to the Community Planning Partnership, and I do think that it would be something that if you could possibly have a look at that in the executive. It's the Sentencing and Penal Policy Commission. The recommendations were set down in February this year. So there has been a local government draft response, which I think leaders, COSLA leaders, local government leaders considered on Friday. But I do think that given some of the recommendations are very relevant to community sentencing and to community services organisations' involvement, in the work of rehabilitation and indeed community-based sentences. I do think it's something that we as a partnership may wish to have a look at in due course, but I would wonder if the executive would like to have a look at that commission report in the meantime. Clearly, the government have, I think they have reacted to one recommendation almost immediately in terms of victim support, but I do think it's something that we as a partnership may wish to reflect on and to consider going forward. I have to say I chaired the Northern Community Justice Authority when there were such things. There were 8 in Scotland. We're going back about 20 years, but they were in place for a number of years. And one of the commissioners was actually the Cabinet Minister for Justice at that time. So it was really good to hear from her again. But I do think that much of what the Commission have recommended is indeed what we were doing 20 years ago. And frameworks change, structures change, there've been changes, but I think the Commission's quite strong in some of their recommendations. So I would suggest that that's something we might want to visit in due course. I'll leave that with you, Jason. I think that the Commission report is available, and I'm sure it's you can see it on the website.
No worries with that, Finlay. If you could take a note of that, we'll and it ties in with a lot of our objectives around victim support and alternatives to prosecution as well. So
that's right, and the preventative and early intervention things as well. So I think it would be of interest to you. So thank you for that. Okay then, so that moves us then to 4.2 in our agenda, which is the Community Planning Partnership Board and Executive Forward Planner. So I don't know if Jason, if you're taking that, or Finlay's taking that, please.
Finlay, I mean, you circulated it, didn't you? So I've no issues from the executive point of view. It's that the meetings are there and the reporting schedules are there. Okay,
Finlay, anything you want to point out on that?
No, nothing at all. It's just there for information.
Okay, so that's there for noting. Okay, thank you very much indeed.
Apologies, Chair. John has his hand up.
Oh, sorry, I was just coming back into, I'm flicking between screens here. Yeah, Dr. Tomlinson, John, please.
Okay, thank you, Chair. Yeah, when I was reading through this, I was looking for when we'd get an update here on the place planning. Jason did mention something about the mapping, etc. But just looking, I don't think it's specifically marked on that schedule. Does that mean it'll be into 2027 before we hear more, and should it be on the pending list? So just to clarify that, thank you.
I certainly think it should be on the list. Finlay, do you have any response, please?
No, yes, you're right in terms of it should be on a pending list. It's just when that is actually taken to committee and what happens going forward. We'll get that on there and get that remedied.
Okay, thank you.
Thank you, John. Okay then, so that takes us to item 5 on our agenda, which is a verbal update from the Chair of the Executive Committee. So Jason, please.
Thank you very much, Chair. So again, I'll keep this fairly tight and brief. So we undertook the last meeting on Wednesday, 22nd of April. The first item of note that was discussed was around the flash reporting update. So this was more for an internal bit for us in terms of the cohesion and the cooperative reporting from the various area managers and thematic leads. It was a discussion that was focused on place-based planning, the progress being made on developing the place plans, and a little bit around the capacity constraints and inconsistent management. There was concern about limited strategic leadership and unclear accountability as well at pan leadership level, but the one sort of thing that came out loud and clear was that progressing all 17 place plans, and this might stimulate a conversation simultaneously, is unrealistic, and that there's a bit of prioritization needed with fewer plans delivered more effectively. Again, highlighted was the improved use of data, some clearer governance and stronger partner engagement were identified as priorities. So there's a number of those things that are being taken forward off table in terms of some of the operational bits and pieces. And I know Jack said to Rob that there's conversations being taken within the local authority about the number of place plans and how that's taken forward. So Rob, I don't know if you want to sort of comment on that. It's an ongoing piece of work.
No, just that we're looking at our place framework at the moment in the background, so we'll report through on that in due course. We were due to report to council in June around place, but given that we will have the findings from the sessions that we've undertaken through community planning, we won't be in a position to do that. So we'll take that information through the executive and through the board first, and then we'll be looking at a report later this year, I would suggest. But there's obviously council discussions around some of that in the background.
Yeah, and linked to that, obviously we had the workshops as well. So the outputs of those workshops will seek to inform and potentially influence some of those conversations as well. So there was a further paper just around the CPP oversight and the reporting arrangements. So I mean, linked into the flash reporting, the template was approved, and that there hopefully will be now a uniformity around reporting from the various areas, the LCPGs, which will hopefully allow us that easier download of progress and impact that we're having for the work that we're undertaking. There was a discussion around delivering the place-based community plan in Aberdeen workshop outputs, again as I've referenced here. So the report will come to the executive in when will that come? Keep it right. The next one is
the next August.
Yeah,
Discussed, and then the board, subsequent board in September. Again, hopefully the feedback from the workshops, as you're probably aware, was really, really positive around the way that Dermot facilitated that. There is a lot of information that has come from those workshops that will need to be digested and again presented, discussed, and worked out how we take that forward. Putting people first, so the Fraserburgh Community Appointment Day was discussed, and the evaluation of that was chatted through. There was broad agreement that it was a really successful day, an event with quite a few numbers. I think it was in the 40s, was it? I'm trying to remember off the top of my head how many people attended. It served as a template for the next one, which again, please keep me right, I think Stonehaven, was it?
Yeah, I think so. Yeah.
So hopefully that will be coming up. And again, will be similarly successful. Again, the Strategic Community Planning Fund was discussed. So we had a chat around ArcGIS and the evaluation report around that. There's a discussion point in the finance paper that is later on the agenda, so I'll leave that to there. And our discussion around Mind Your Mind as well. And I'm aware that that's obviously item number 7 for discussion later on. We also had the new Chief Exec of Aberdeen FC Community Trust. Ed came in and gave a presentation regarding their work. There was clear overlapping opportunities for collaboration with Community Trust. I know we as a Police Scotland do work with them already, but it was just a information session as well in terms of how that might be proliferated across the wider CPP. And then there was the Aberdeenshire CSP report as well was discussed, but I'm aware that that is an item later on in the agenda as well. And then I think was it in terms of the exec report. So we got through a lot of work, again, the workshop outputs and how that informs our thinking in the coming months was probably the key bits. And that was the report from the executive.
Thank you very much. Certainly a lot of work been done. So can I ask members if you have any questions for Jason and or Rob around the work of the executive? Shantini, please.
Thanks, Chair. I was just wondering whether there were so I'm not sure whether I understood your report, around producing the report around the place plans. It sounded like there might have been some delays, and I just wondered whether or what the barriers were and whether there was anything that we could support with, to get over that. So, but it may just be logistics and things like that. So I was just wanting to explore that a little bit.
I mean, Jason, we're just working through the outputs from the various sessions that we had across community planning. They will be used to help inform our position going forward. So it's really just understanding all those outputs, which will inform what we do moving on from here. So I wouldn't say it's necessarily undue delays or anything around that. It is just that full understanding to inform the picture.
Okay, Shantini.
Yeah, no, that's great. Thank you.
Although I do think we don't need a written plan to amend the way of working. So we can work in a place-based situation. You know, we do not need that paper document. We don't need a document to be able to perhaps change the ways of working as was discussed at the workshops. So let's not wait for the paper plan. Let's look and discuss how we can work differently, as we heard in the workshop, from now. So again, I think we just need to perhaps just move forward at pace with some confidence, and there'll be trials and errors, but I do think that working within the place to deliver on the place or for the place is sometimes just about the way that we work at a local level. So, but thank you for the question, Shantini. So thank you very much. Alison, please.
Yes, thank you. I'm aware that Aberdeenshire Council Economic Development team are assigned to plan for a just transition plan for Aberdeenshire. And I'm just wondering in relation to how that really then connects into the place plan and our work here, and just maybe some clarity about that would be great.
Rob, can you help with that?
Yeah, I suppose suffice to say that we work across all different areas to ensure that we are building in those different things into what we do going forward. So Paul from Planning Economic Development is absolutely central to what we're doing around place going forward. So he's a key contributor around that piece of work. So I suppose just the reassurance that we are ensuring that everybody is around it, everybody's feeding into it. We are getting all those different stakeholders involved as we need to.
Was there anything specific, Alison, that you were wondering about?
No, I just wondered to what extent it's just quite difficult. Was thinking about holistically, and that came across in the workshops quite a bit, just ensuring that we are really feeding in and it's just getting that clarity, which I think I just got from Rob. So thank you.
Okay, thank you very much indeed for that. I don't see any other indications.
Sorry,
so...
Chair.
Oh, sorry,
Chair.
Jason.
It's Jason again. So
yeah.
If I could just refer back to your point around, absolutely right in terms of we don't need a written plan to start doing this. So we've already augmented our operating model. You'll be aware that enhancing community policing is probably coming at the early part of next year. But we've put teams in place in and around Fraserburgh and Peterhead, and I know that Terry and the team have been doing some really good work with the team there, and that's just us moving towards that place focus. So again, I don't think any of us organisation wise are waiting for that plan to come through before we start moving in the direction of police delivery.
Yeah, thank you very much for that, Jason. And Sergeant Brady's been getting himself around community councils across, well, I think he's got 181, I think, but he's been visiting community councils certainly throughout Aberdeenshire in recent weeks and months. So very much delivering on that different way of working and the community policing being really at the heart of communities. So he's certainly been well received, Jason, in the meetings that I've been in attendance. So it's good. Yeah, thank you. Okay, so with that then, thank you very much indeed, Jason and Rob, for those updates and for the work that's going on within the executive. It's really very helpful, and we'll get reports as you deem appropriate as we go forward. So thank you for that. We'll move then to item 6 in our agenda, which is the Community Safety Partnership Report. Annual report, and I'm pleased to welcome Ali MacLeod to the table. Ali, Head of Housing, and has community safety in his remit, and he will present the paper. but we're being asked to review and comment on the Community Safety Partnership report and agree to receive further updates through the quarterly flash reports that identify early progress arising from the appointment of a chair for the Community Safety Partnership, alongside work to further integrate community safety activity into Aberdeenshire's place-based arrangements. So with that, Ali, I hand over to you to present the report. Thank you.
Thanks, Chair, and good afternoon all. So I will cover off the arrangements that we have in place around about community safety, and which I think are of relevance to the Community Planning Partnership, along with an update on the activity that has been ongoing through the Community Safety Partnership over the last 12 months and continues to be so. The Community Planning Partnership will be aware that in recent months that the Community Safety Partnership has not had a chair. That's been a matter that's been discussed in the Community Planning Partnership Executive. That has, I suppose, limited the extent of progress that can be made by the Community Safety Partnership. At 4.4 in the report, you will see that Police Scotland have offered to take on that chair going forward. So we're really pleased to hear that commitment, and that will help us to progress a number of areas which I'll come on to talk about. And we're also in conversations with Scottish Fire and Rescue Service as well in terms of their support to the Community Safety Partnership. So we are in a more positive position than we have been in recent months. Second area which I'd like to touch on is just about the what that means in terms of re-establishing the Community Safety Partnership. We'd like to get to a place where reports such as this one here can clearly demonstrate a picture of the outcomes that we're achieving. The report does contain a number of updates on various areas which I'll go on to cover, but specific outcomes we are still to articulate and quantify it. So we'd like to clearly report on that to the Community Planning Partnership. So we've covered some of that off. And thirdly, there's a commitment in here that we align our community safety arrangements very much with place planning activity that is ongoing through the Community Planning Partnership and through Aberdeenshire Council. The proposals that we have are that we will be using our community safety data to inform priorities that are set at a local level in terms of place plans. We're working with local communities, and we'll be bringing our community safety partnerships together at that local place planning level. That will support what we're doing at an Aberdeenshire level, at that level across in terms of the existing community safety teams and joint working arrangements. So those are proposals for consideration by the board. In terms of the actual activity that we've been taking forward in recent months, we'll continue to deliver the 3 priorities, which are antisocial behaviour and violence, safeguarding communities and unintentional harm. Specifically around antisocial behaviour, that continues to be part of the regular multi-agency coordination arrangements. There's youth antisocial behaviour, which police in Scotland are leading on. We have our own mediation services, which have a significant impact. And this ties across to our contributions in terms of serious and organised crime as a partnership. You'll see in the report the reference there at 3.10 to the community safety wardens and how these are now being more have been deployed more across different areas across Aberdeenshire using an intelligence-led model, expanding their role from just Peterhead and Fraserburgh to different communities. And we've aligned that with the work of Police Scotland around about their own community policing teams, and adding that together is something we want to build on in the months and years ahead. And just finally, one thing I'd like to highlight is the work that we've been taking forward around drug and alcohol education for secondary schools, which is detailed at 3.12 in the report, and having quite a significant impact with quite a significant range of pupils in recent months. And again, planning for that is underway for the year ahead. Happy to take any comments. I'm joined by Mr. Martin, who's the team leader.
Thank you very much indeed, Ali, for the report, and thank you to Andy as well for the work that goes on. And I think it's really welcome to hear that you are working more in terms of data, and also we must have the evidence to present outcomes as well. So that's all very welcome. Thank you. Councillor Reynolds. Glenn, please.
Yes, thank you. Apologies in advance if this is a bit tangential, but I think in this day and age it shouldn't be, and I very much appreciate what you've said in terms of the presentation, but I'm wondering the extent that you're incorporating the ongoing surge in digital and virtual harm, and in relation to much of what we cover within this partnership, that the challenges that are faced in terms of data sharing between the fact that within health boards and such like, you know, the sharing of information and data, as we know, it's a very timely issue to raise at the moment in terms of how we do that online, and that is very much at the heart of community safety as well. Is that incorporated in the work that's underway at the moment?
Ali and/or Andy?
In short, I think the answer to that's no. It's something we are aware of, but it's not something that is incorporated to the broader piece of work in the Community Safety Partnership. That said, with the incoming chair and assistance with the providing the sort of the frameworks for the partnership, I'm sure it is something that comes up. Well, we don't have it specifically addressed within the partnership. I am aware of, you know, Education Services and Police Scotland both having work ongoing. But in terms of coming through the Community Safety Partnership, I think that's something we should be looking at and pick up in the future.
Yeah, I don't
Yeah,
know if
so-
I might be able to add something to that. Is that, if that's okay?
Yes, of course.
So within, and I don't know if Shantini put her hand up there in terms of some of the work that the North East Public Health Alliance is doing. They've got a data, Shantini, I'll leave it to you because you'll explain it a lot more effectively than I do.
So I think with your forbearance, John, Shantini, is it in the same issue? Yes, thank you.
Yeah, no, so it was just to say it was to make the offer really. So under the auspices of the North East Population Health Alliance, we're doing quite a bit of work looking at our data maturity across organisations and across the whole system. So we've started to do that, looking at two key areas, mainly around substance use and whole system approach to healthy weight environments. But actually a lot of that learning can be applied to the Community Safety Partnership as well. And I know there's work that's been done in other places that can probably inform as well. So I put my hand up really to make the offer to, you know, look at, you know, how we might not solve the problem, but, you know, might support and facilitate to work on it together and see if we can get some traction and move things forward. So happy to be in contact with Ali if that would be helpful to take forward.
Thanks, Shantini. Glenn, do you want to come back?
Yeah, I really appreciate that, and the point that Shantini has made there is crucial to what I'm talking about. And I'm no expert when it comes to these matters, but we're all absolutely cognizant of the impact of AI that's coming down, and that is very, you know, we need to, and I'm sure Shantini will be aware of this, but that's a massive development and an evolution which, you know, has to increasingly be part of community safety, and so I'm really pleased to hear what Shantini was describing there in terms of the work underway. But I really think, you know, this is a massive growth area, to state the obvious, and we shouldn't be left behind on this. Thanks.
Thank you all. Again, just
apologies, Chair. Can I just jump in again, just because it's probably relevant in terms of so we're working. Police Scotland have just employed a data scientist, effectively working on a common data platform. So working with the Edinburgh Futures Institute, and again, we because I'm quite bullshit, I want to be a pilot for everything. So we're looking at some work in the Northeast as well about how we potentially explore that as a pilot for a common data platform, using health data, using local authority data, using police data, and layering that up in a community to actually better understand what the community needs are, and then putting service delivery against that. So that's kind of a work in progress, but I'm happy to bring this back to the board to update as we work through that. But it speaks to the issues that the councillor raises there.
Thanks, Jason. I just wonder though, there seems to be quite a bit of overlapping in different places. Yeah. So I would urge colleagues, please, to have a discussion and to see where you are potentially overlapping and or duplicating, because that's three different approaches, three different partnerships that are or organisations that are actually working along similar lines. So I think that whilst there are, you know, it's very welcome. Can we please try and ensure that we're not duplicating and overlapping work? I mean, I'm sure it's probably different, but I mean, I think this is why we're here, is to actually try and simplify, cut out duplication, and try and work towards you know, one end, if you like. So but Jim, again, sorry John, but Jim chairs the alliance, so I'm going to take Jim in if that's okay. Thanks.
Yeah, Chair, I think it's a decent point you're making, and I can give you assurance that we'll make sure that stuff is aligned. I think it's a big task. And I think that, you know, I know work of Edinburgh Futures Institute, and they're particularly capable. I think their expertise alongside the great work that Shantine and colleagues are leading at a local level will complement each other, while they conflict each other. That's where we'll make sure that, in a blunt way, if we had cracked it by now, sort of, we haven't. But yeah, we'll make sure it's aligned. It's a big job. And I think sort of the fact that there may be a couple of different ways to go about it is just reflecting the scale and nature of the task, as opposed to, I think, something being clunky.
No, that's absolutely fine. Just to urge folks to speak to each other so everybody knows where everybody sits and who can do what for sharing. That's fine. Thank you for that. Dr. Thompson, John. Oh, sorry, who was that?
It was myself. It was Andy Martin, but I see that John.
Sorry, Andy. Yeah, I'll bring you back in after John, Andy. John, thank you.
Okay, thank you. And my question was going to head in the same direction as well. I was noticing at 311, page 13 of the pack, the comment about the concentration of demand on a relatively small number of individuals, and that's probably been the case for quite a long time, that it's been recognised. So I was welcoming the approach linking this into place planning and thinking, well, there's a number of individuals through this work, there'll be a number of individuals through other work, and there'll probably be some overlap there as well. So that does head towards place planning. One of its key opportunities is this sharing of data. And so there's the mechanics of that, but there's also the permissions. And it is something that we come across in multiple places, as Jim's saying as well. So I do think what you've headed towards here, and is us not all having to try and reinvent or invent the wheel on this one, but being able to play into what's going on. And it strikes me it's probably a national issue, especially on the permission side. But I know there's a lot of frustrations amongst different teams as well when they're trying to do things around this. So it's really just to reinforce that and see the opportunities that are evident in the approach being taken. But I see Jim wants to come in again, so sorry.
Jim, please.
I think as John reflected with this stuff again, it reinforced my point. It's hard. And certainly in the work of the Population Health Alliance, from a Grampian point of view, the matter in terms of data access is sort of in the midst of our work, as well as that point in terms of prioritisation, in terms of need, demand and risk and harm as well. So both are reflected in scope. I think it's John also reflected those questions in terms of data sharing and data quality are national legislative conundrums, and I've lost count of the number of conversations to get to, and looking through IRDs and other matters where we've bumped into this has been a perceived or actual inhibitor as well. So it may well be that's where partners like the Futures Institute and others can help us to see whether legislative change is required or whether it's local convention and work in practice, which is the matter as well. But I think that the points well made, you know, that both helping us continue to evolve our prioritisation and look at better joint working are right in the heart of the work for the Population Health Alliance. Thank you.
Thank you for that. And Shantini?
Yeah, and just to add to that, I think given the volume of work, and you know, it is all joined up because we're all part of the same conversations, albeit coming from from different topic-based areas sometimes, but the underpinning or the underlining theme is the same. It is about data sharing, but we may be getting to a place where it might be time to do a bit of sharing our learning from different places and looking to see how we can move forward as well. So we can probably look to see how we can do some sort of learning event towards the I guess in the autumn or something like that, when the time is right, bringing together the learning from all these pieces of work that we've been talking about, and that should also help with supporting a joined up approach across the piece.
I think that would be really helpful, Shantini, because if there are, and who knows which other organisations are out there trying to do the same thing. So I think that coming together would be very, very welcome. So thank you for that, and happy to leave that with the executive to pull together. Andy, you wanted to come back in, please.
Yes, certainly, Chair. I can comment on a few of those things just for a comment in terms of the community safety perspective.
Yeah.
The operational, the data sharing that we have at the moment is largely operational, and well, and in terms of the sort of any question of the community safety partnership trying to solve the data sharing, the data analysis in its own right, I think as is mentioned in the report, we kind of moved past that in terms of we used to have an in-house analytical capacity, and that's no longer the case. So we certainly have to work with Shantini and Jason and some of the groups they're involved in terms of getting that capacity, which also in terms Councillor Reynolds mentioned the AI, and well, his point was around some of the community safety implications. What we do have an opportunity for at the moment is using some of that operational information and data that's shared, and because the council has a co-pilot license, there is some analysis we can carry out there. We have to make sure all the partners are signed up to that in terms of permissions and use of data. So that's something that we can have as a priority for the community safety partnership as we get things going again. And I think the other point I was going to make around the Councillor Reynolds' comment about AI and increasingly people's lives being in the digital space and being online, that is something that we see, and there are some, everyone will be aware in terms of the public space around sort of issues around concerns around polarisation and social cohesion, and that is something that we pick up on, operationally and in terms of the work of the various partners. A known and emerging issue that probably bears some attention going forward.
Okay, thank you very much, Andy. Just one last call if there's any other observations or comments. I have noted in the chat some comments about perhaps reaching out through our community planning partners, Anne and Rebecca, in terms of any national issues that may arise from any work that goes on around this particular issue. If there are any legislation was mentioned in the past, but maybe our place directors, Anne, I don't know if you wanted to comment at all, but it may be that we would come back to ask for some assistance if there were any national issues that needed to be taken forward.
Happy to help. If you want to come back to us, yeah, we could take that away.
Thank you very much for that, Anne, and that's there for everyone to remember that we do have support and guidance from our place directors. So that's very welcome, Anne. Thank you for that. Okay, thank you. So with that, I have referred to the recommendations previously. Can we, Ali, do you need any specific guidance or steer from the board, or does your recommendation capture what it is you need to find out from us today?
No further steer required. Plenty from the discussion there. There's a few actions we can follow up on, and we'll give a report back to the planning partnership in due course. Okay, Ali, thank you very much indeed for that. So members, are you content to agree the recommendations as set out in the report?
Agreed.
That is agreed, and we do have a recording of the conversation, so we can pick out some points, Finlay, that can be noted and perhaps shared with the wider executive. So that's fine. Thank you very much, and thank you, Ali, and thank you, Andy. That takes us to item 7 on the agenda, which is Mind Your Mind. And pleased to welcome Caroline Lamb to the meeting. Mind Your Mind has been reported through this board a number of times, the campaign, and we're being recommended to endorse option 1, which is the preferred option from officers within the report. With strengthened sustainability actions. We're being asked to approve the integration plan for place-based community planning, and we are being asked to note the evaluation findings and benefits realisation and approve the withdrawal plan for future use if required. So with that, I'm happy to hand over to Caroline and invite you to speak to your report, please.
Thank you, Chair. Thank you, everybody. Yeah, just I know that you've seen the papers, but maybe just to give you a little bit of a summary, would that be helpful, Anne?
Yes, thanks, Caroline. Yeah, thanks.
Yeah, so it was really just to provide, we were asked to come back with a 2026 update, which we did provide to the exec in March, and they had some questions, I think, around further evidence that they wanted me to present at this meeting, and which I have given as an additional paper. Apologies that you haven't got the IIE, that is still going through the process. There wasn't really any change to the IIE, but we have made up a new one, but it was literally just dates that were changed in that. But I think we were asked really about the main outcomes for the campaign, so I'll maybe just give you that as well. So really it was around increasing awareness of mental wellbeing support across Aberdeenshire, improve access to accessible preventative wellbeing resources in community and workplace settings, strengthen that partner and ambassador engagement and in promoting the campaign, which I've given in the evidence paper, and really trying to use the resources that we have within the campaign to really use that within local events, local distribution and social media activity, which again I've presented in the evidence paper. And it is really obviously across that wider support and early intervention and self-management through accessible resources. And I'm happy to answer any questions if anybody's got any specific questions.
Okay, Caroline, thank you very much indeed for that. Colleagues, do you have any questions you wish to pose? John, please, Dr. Tomlinson.
Yeah, thank you. I wonder, just in terms of the evaluation that you've done, whether you identified that there were particular gaps, especially given the rural nature, the spread nature, and the differential in the types of third sector that are in different places, and whether that was an issue for taking things forward. That's my question. Just as an observation, the whole thing is much tighter than what we've seen before, and on that basis, I think that's encouraging the work that's been done. But that's my question, Caroline, if you could comment on that, please.
Yeah, thank you. There is, I mean, I can't lie, there is differences across all the different locality areas. So you'll probably, if you've looked at the toolkits, they are very specific to the local areas. So that won't be the same across every area because it is dependent on what is available in that local area. I think that was highlighted within the exec meeting. They were questioning the difference between our local Aberdeenshire campaign compared to the national Mind to Mind campaign. And the main difference is we are connecting people into local services within their communities, which Mind to Mind is not doing. It's a completely different type of campaign. So I don't know if that's answered your question, John, but there is differences because of that. And it's sometimes difficult for us to get feedback from those local groups on the evidence of people coming to them because they've seen the resources. So that is an ongoing, issue there.
Okay, if I can come back.
Of course,
yeah. So I'm here representing the IJB, and I appreciate it's a two-way street as to what information they can provide to yourself and vice versa. So I suppose at some point with IJB colleagues, I think it's a question that we will want to try and dig into a bit further to see if there are areas where we've got potentially an under-provision and therefore a build-up of issues that are going to be problematic in years to come. So I'll look for that through the Health and Social Care Partnership. Thank you very much.
Thank you, John. Thank you, Carlin. Any other questions for Carlin? Jason, from the executive's point of view, were you content with the outcomes of your deliberations?
So a couple of observations I make. So when the report came through, Carolyn, and apologies for this, because again, I was the catalyst of, I suppose, the refreshed report around tightening the impact, tightening the benefits that had actually been produced by the campaign as well. So I think we got to the point where we more fully understood the intentions in terms of the ambassadorship, the highlighting, but the way that it was integrated into the wider Aberdeenshire mental health and wellbeing delivery plan, and it wasn't a standalone sort of delivery plan of itself, it was more an augmentation of that. So when we sort of clarified that, we were in a much better place in terms of, okay, understand what the objectives are. I still think that there was work to do in terms of the proliferation of the messaging and the, you know, what the outcomes were or are to be, and I think that's a bit of work sort of ongoing in the next couple of years. But the benefits, I think, for me, in terms of, you assured me that there was no enduring financial implications, and it was an ambassadorship, and it was a continued methodology to highlight concerns around mental health and awareness and toolkits and the help and assistance that is out there for our communities. So once all of those things, I think, were clarified and crystallised, well, the executive would, I think, are in a much better place now in terms of supporting option one. And yeah, so that's where we were at.
Okay, thank you very much for that clarification. Thank you. Anyone else have any questions for Carlin? And again,
Cheers.
Carlin, oh, sorry.
Sorry, Chair, it's Davy Meldrum from the Fire Service.
Oh, hi, David. Yep, and you come.
Hi. And it's just an observation more than a question. But as I was going through the paper, I had a look on our Aberdeenshire website, and it's not very prominent on that website. So you really got to do a little bit of work to find it. And if it's something that we want to be promoting and getting people to access more, it may be worth just looking at putting something else onto that homepage to direct them to the Mind Your Mind materials. Because I could only find it through doing a search for it, and then it comes up as a sort of news article bit. But if you were just going on to that site, your chances of actually looking at it are pretty remote. So as I say, it's just an observation that if we were going to go with option one, it might be just how do we raise the profile of it through that site itself.
Carlin?
Yeah, no, I agreed. Yeah, that has been noted. Somebody else actually came back to us and said the same thing, and I don't know if there's maybe just a missing link somewhere in the website, but we'll look at that definitely and get that. That needs to be updated. I agree.
Thank you. Have all the partners around the table, Carlin, got links on their websites?
What you mean here? Sorry, Anne, is that the question? Sorry.
Yeah.
I don't know. I don't know.
Is that something that you could follow up on? Because
yeah, definitely.
The further, the more publicity that's out there, or more access to the information, the better. And so can we make sure that all our community planning partners around the table, and those who are apologies in today, but all the partners in Finlay can help you with that, to make sure that they've got the opportunity to share the link on their pages as well.
Okay, and just a note, sorry, just to come back on the mental health side of things, the mental health strategic group have agreed that we will work with them on really embedding the campaign as part of their new delivery plan as well.
Yeah. Okay, that's helpful. And the other organisation that might be useful, you may well have links anyway, is the Citizens Advice Bureau across Aberdeenshire, because again, that would be something else they can help to publicise.
Okay, no, I know there's advice, so I can easily definitely link up with them. Thank you.
Yeah, that would be great, I think, to do that too, because the issues that you are trying to support are becoming more and more of a thing. So I think the more we can get the message out, the better. And if anyone has any other networking opportunities, then if you let Carlin know, then that would be really helpful. So thank you all very much indeed for that. So we have questions within the recommendations. So are members minded to endorse option 1, approve the integration plan, note the evaluation findings and the benefits realisation, notwithstanding that Carlin will do more work on those outcomes, and approve the withdrawal plan for future use if required. Can we agree those, please?
Yeah, agreed.
Agreed. Okay, Carlin, thank you very much indeed again. And as I say, if there's anything else that, or any other, I know that you're quite good at getting in touch with folks and asking them to share your information, but please ensure that everybody here has got that information and links and has got you've got the networks covered.
Thank you,
Okay.
everybody. Appreciate it.
Thank you, Carlin. Thank you very much indeed. Thank you. That takes us back then, colleagues, to item 8 on the agenda, and this is Jason, who's going to give us an update on the Community Plan and Partnership financial situation. Jason, please.
Thank you very much, Chair. And again, I'll just draw reference to what we're asking for today. That's to note the budget monitoring information for 25-26 for the Strategic Community Planning Fund as of 15th May 26, and thereafter consider and agree the CPP's approach to joint sustainable resourcing to deliver the Lloyd priorities and review financial contributions from CPP partners. This will no doubt prompt a little bit of conversation, hopefully. So the actual expenditure and finances are there to be read, and I won't dwell on those, just to highlight just a couple of bits that the money was spent on. So for Martin Kincard and Mayor's Place Planning Fund application was there, highlight in paper. The ArcGIS story maps funding application is there, and also the sort of refund based on that, because the expenditure wasn't as much as we initially thought it was going to be. I think part of that is, again, augmenting the tools that we have to tell the stories of our places, and using all the data to then sort of storyboard and again tell that story of places. The other bits there I won't break down individually, but you can see that the funding from Police Scotland's point of view, Nestrans and NHS Grampian, the contributions have remained the same as they were last year. So I will use that as a catalyst to prompt some conversation around that. The one thing that I'd highlight from Police Scotland's point of view is clearly our new operating model will lead us towards hopefully an operating model that enhances that community policing element of it. So it's not only by financial cash terms the contribution is made, it's also by putting people towards that place, delivery in a place that obviously we're doing and trying to augment our operating model around. There's also the contributions that we make individually as organisations in terms of coming together. So again, not wishing to preload the conversation around that, but it is a key sort of element of the conversation as we take it forward. I hope that at least the financial element from Police Scotland will remain in its current form, at the very least, going into the coming years. However, we are operating in very challenging financial envelopes, all of us as public sector organisations. So that challenge does endure as we go into the next couple of financial years. So that's the paper, and I'll be keen to have a conversation around that.
Thank you very much indeed for that. And so, colleagues, do you wish to start the conversation, please? No one wished to make any comment or ask any questions? I don't see any hands, but anyone in the room?
Yeah, I jump in, and I've
Jim, thank you.
Good order on this one. I've been told otherwise swiftly. I think as Jason reflected, it's no misunderstanding. Everyone in the room is going to be working under sort of financial sort of pressures in some shape or form. That's the norm here. I think what the paper does reflect is a consistent partnership of contribution and commitment that's sustained and is sustaining as well. And the tone I get maybe from the side, and so for me that way is that people will continue in lockstep in the same tone and manner. I think as Jason reflected, whilst the numbers may change, I think we commit in terms of how we make sure that the partnership works, be that in kind or be that in terms of commitments needed. It does feel to be is the important focus in terms of ensuring as well. So in contextual terms, it feels like a positive paper without any presumption about it.
Thank you, Jim. Anyone else wish to make any comments? Yeah, Councillor Reynolds. Glenn, please.
Yeah, I just wondered, if I may, I'd like to ask a question about, a reassurance really, and that's, we're all aware of not just rising demands, but there are certain scenarios that specifically impact and are incorporated within our remit regarding abuse, mental health, long-standing coordination challenges across delivery vehicles. Are you confident and are you reassured that in the short and medium terms that we're on a good path that's sustainable? I know it's a high level question, but things are heading in a direction of increased demand over the, I mean, we all know in the public sector, not least. So are there reassurances that there are plans that enable us to cope with the foreseeable and even the unforeseeable in some respects? We're in a very uncertain world, and that's the sort of risk element that I'm sort of questioning. Are we confident that we've got suitable risk factors incorporated in what we're doing in terms of our financial plans? Thanks. Thanks,
Glenn. Jason?
Great question, but well, Rob, you're looking like you're ready to come. But the one thing I would say is that we do crises pretty well, and we respond to those through the resilience partnership really effectively. So when those things do occur, the coalescence and the collaboration and the collegiate working is first rate, and we've got numerous examples of that over the years in Aberdeenshire. The other thing to highlight as well, and I think Andy and Ali drew that out in the community safety paper, is that operationally on the ground, activity is taking place, and we are delivering operationally as a partnership. Some of the things that we talk about within the executive and here in the board is that sort of moving and the continuous improvement bit, because there is, around place plans and ability and a desire for us to work more collaboratively and in a more integrated fashion. That's notwithstanding, there is some really, really effective operational delivery that takes place in the partnership setting already. So I think that, I mean, if I had my way, not that I do, but I would move towards a more of a coalescing of budgets right across the public sector to coalesce around place. I think we're a long way off that, and I don't know what the appetite across the government is for that in the future, but it makes complete sense to me. But hopefully that it's reassuring that there is the operational delivery that is existing and will endure from us as well. So Rob, I don't know if it...
Yeah, through you, Chair. I was just going to say, I think the financial position is relatively robust. Obviously, we never know how that's going to pan out in future years. Everybody does have their own pain points and things that will come at them from various different sides, which may impact on that contribution that is currently made. However, and Jason has touched on it, I think the real strength is in the partnership beyond the strategic. So the operational is very, very good. We are very good at coming together where there are issues and situations that need to be dealt with, be that through the resilience partnership or be that just on a day-to-day operational basis. So I think that there's real strength in that partnership there that should hopefully provide the assurance, together with a relatively robust financial position behind it at this point in time. So I think we can be relatively assured by where we're at the moment. We never know what's going to come in the future, but I think we stand in good stead going forward.
Okay, Glenn, do you want to come back?
No. That's, I see that John might want to come in, but I mean, no, that's fine. I thank colleagues very much for the contributions they've made. It's very helpful.
Thank you very much. Dr. Tomlinson, John, please.
Yeah, thank you. I was kind of reluctant to come in, not being one of the contributors to the funding here, but that wider point is that we need the community planning, and we need to continue to make the steps to make it as effective as possible. If it wasn't here, we'd have to invent it. And for the sums that are going in. I appreciate the council puts in a lot more in kind. It seems to me it's pretty good for the price of what we have. But it's that second part. So this is internal domestic sort of running the partnership. Is actually how we collaborate on the overall budgets, and how we can make those work more effectively. And I'm assuming that with the place-based work, as we all get around that, that's where some big shifts might be able to be made. And as I mentioned, I'm here with an IJB hat on. We have nearly £500 million of money coming through that. The other partners have got even more. So there is enormous scope there for the way this can go forward in future. So I know that's going off the exact point of this budget, but I think from one of the partners, I see it being handled very well and being good value. Thanks.
Thank you, John.
Thank you.
Any other contributions, please? I don't see any indications of anybody in the room want to come in. If you can't get your hand up, that's fine. Otherwise, we'll move back to the recommendations. And the recommendations, as I look, are to note the budget monitoring information for the Strategic Community Planning Fund as of 15th of May this year. Consider and agree on the CPP's approach to joint sustainable resourcing to deliver the LOIT priorities, and review financial contributions from the Community Planning Partnership partners. Now, don't know if we've gone as far as you would have liked, Jason, for the second recommendation. It appears that folks are not content, but are acknowledging the input from the partners that are listed. And I think we have tested the water previously, and I think everyone's capacity and resource is probably as stretched as the other. So I'm not sure, Jason, if you want us to go any further, or you're content that we agree the recommendations and we accept the allocations as set out in the paper.
No, I'm content with that, Chair. And again,
Okay.
that periodic discussion and circulation of that issue is appreciated.
No, that's fine. It does raise awareness and just lets everybody, we need to recognise the allocations that are there, and some of the other implications around some of that as well. So I think we can do that. So we'll agree recommendations then, please. And that's agreed. And thank you again, Jason, for your report and for the thought behind your recommendations. Thank you. We'll turn then to item 9 on our agenda, which is Housing First and Housing Scotland Bill presentation. And again, I'm happy to invite Ali MacLeod to take the floor. Thank you, Ali.
I'm just sharing presentation if that works. Okay, thank you, and thanks for the opportunity to present on the Housing First project.
Can I just check that everyone has got the presentation on their screen?
Yes.
Yeah, everybody's seen it. Okay, thanks, Ali. Sorry.
No, thank you. This is quite timely, as there was new housing legislation which came in September last year, which places duties on all public sector partners around about homelessness, and specifically to ask and to act if you believe there is a potential homelessness situation about to transpire, as in if you feel that somebody's housing circumstances are under threat, you have an obligation to refer on. That will be coming through once their statutory guidance published in the coming months. So we're working with partners directly on that specifically. One of the ways we do help tackle homelessness in Aberdeenshire is through our Housing First project, which is involvement from a number of partners. Is very much a really good example of community planning in action. So who is it for? It's primarily about supporting people who suffer from multiple factors of deprivation, trauma from poverty, and people who've been involved with the criminal justice system, or those who experience mental health, ill health. It very much does meet the community planning partnership priority to tackle poverty and inequalities. It's also about housing as well. People who have either had failed tenancies and repeat homeless presentations, or it's a preventative measure where we believe of young people who are about to enter that cycle of homelessness. So those are the people that are typically referred in. In terms of what Housing First is, there are 7 principles. It is an international model that's been in operation and been very successful in different countries since the 1990s. It's been adopted in the UK over the last 15 to 20 years. I think Aberdeenshire was one of the early adopters in Scotland. Primarily about right to home and having prioritised access, choice, control over the home. That comes with support attached, but housing is not conditional on staying involved in that support. But how the support is provided is through different approaches, which will be familiar to different partners around this table. One of the principles there is flexibility. So as long as support is needed and in the style that's needed by our clients. So for example, NHS Grampian's plan has an aspiration in there that individuals are supported with access, care, treatment, support in a way that's best for them. So it's very much aligning with that. It's also about taking an active engagement approach. So small caseloads for a Housing First team. As a service, we'll handle up to 100 cases at any one time, but no more than that, because we need to ensure that each Housing First officer has the capacity to provide dedicated and intensive support. It's about taking a harm reduction approach, which will resonate, I'm sure, with police and fire, in terms of reducing and minimising harm to vulnerable people through a multi-agency approach. And also, it's the principle there is about asset-based and community capacity building, which I think we can all recognise as a way forward. What does this partnership working look like in Aberdeenshire? A lot of joint work, particularly with drug and alcohol workers, particularly criminal justice. We have an open referral system open to all partners. There's no waiting list for support. We had the safety partnership update earlier on, and Days of Action is one of the initiatives that is led on by the Community Safety Partnership, and that very much ties across to Housing First, where we can fit in. And we do work very closely there right across partners, carrying out outreach visits, just to try and reach some of the people that maybe are missed out day to day. We do provide opportunities for joint training across different services as well, and naloxone is one of those examples as well. And there's some really good collaboration which takes place. So I've focused in here on our joint working with HMP Grampian, where we've introduced new procedures, a check-in procedure, where every prisoner admission is contacted via email to ensure that nobody's missed out. We are very much proactive in trying to plan ahead for anyone who is leaving as well, and just to ensure there's no gaps, and that with planning ahead as much as possible. Some of the outcomes that we've achieved, or the model has achieved, is quite powerful. There's the return on investment of around about £1.56 for every pound that's been spent. And it's been recognised, as I mentioned earlier, at an international level. One of the things that we see more locally is that ability that it does break the cycle of homelessness, and also break the cycle in terms of demand for different services as well. And as I mentioned earlier, it does target the hardest to reach people. I'm not going to go through all these testimonies that our partners have provided around about Housing First. they'll be able to access on the presentation when it's shared. But it's quite powerful. I think it is very much valued by different partner organisations. See the benefit in terms of people that come across their doors. This kind of testimony is mirrored actually by some of the clients we work with as well. You'll see these comments, they're really positive. I think as you read these, I'm just going to give you an overview in terms of some of the headline outcomes we've noticed and researched in recent months. So carried out a survey just last year where around 80% of our clients had more than 3 previously failed tenancies. 100% said their access to services had improved through this approach. 42% said their physical health had improved, and 95% felt their mental health had improved. 84% said their use of substances had decreased, and 79% reported a reduction in reoffending. We've seen that 79% felt their financial situation and budgeting had improved. The main reasons for this was the role of Housing First in terms of as a model of support and having that wrapped around support from all the different services. And if we compare that self-assessment with what we've seen as a provider of housing services, we see 85% tenancy sustainment for these clients. Now that's pretty close to what we see for all of our tenants. It's quite powerful, really, given the level of vulnerability and chaos that we have to manage. So I think it does speak volumes in terms of the model itself. Majority of those are sustaining their tenancies for over 2 years, just under 60%, 25% 1 to 2 years. The remaining 60% is for less than 12 months. And since the receipt of housing support, 43% have had no emissions, which again is quite significant. We're beginning to see a reduction in repeat charges as well. That is we still do see repeat charges, but that has come down now, and it's increasing as well. I've shared as well some links in terms of the model which can be accessed. So once the PDF is circulated of the presentation, but we just wanted to flag it up as a really good model of community planning in action. I feel it does meet the 2 priorities of the community planning partnership in terms of tackling quarantine and inequalities. Also about place, because when you wrap around these services in a people's home, that is very much taking a very place-based approach to delivering services, using the home as the anchor, and then wrapping around those services. So has been very successful. Happy to take any questions, and also happy to pick up any of those conversations that we need to do in the future around about the ask and act duties I mentioned at the start.
I think you're muted.
Yeah, I am. I've just realised that. So thank you very much indeed, Ali, and for your presentation. And Finlay has just circulated the slides, so everyone should have a copy of those as well. So happy to invite Councillor Reynolds. Glenn, please.
Thank you very much, and thank you, Ali, for that. This is it's a great project, and the data that you've put before us seems to indicate that it may well be that you've already addressed the point I wish to make, and that is as I see it, the fundamental problem, the juxtaposition of triaging people through to the programme, Ali, that are suitable for the programme and how you do that, but then the logistics around making sure that that people end up in a scenario where they are in a geography which is difficult in rural Aberdeenshire, certain pockets of rural Aberdeenshire, where their support networks need to be nearby, and that tension, I'm just wondering whether that is an ongoing frustration or how you overcome that, and whether that is actually a serious challenge. That effect that people really do rely on the journeys that they're engaging with, on that, the immediacy of that sort of support network, if you like, and the geography of that and what they're used to, and the people that interact with them. Ali, thanks.
Thanks, Glenn. It is a tension that does exist. Certainly, and the point you make around about the importance of those support networks is very true and really important in terms of actually achieving positive outcomes going ahead. I think we're quite fortunate in Aberdeenshire, where we have a reasonable supply of housing options. I touched on in the presentation how there's an element of priority afforded to these clients, so they will come up fairly high in terms of our banding for access to housing. It does give them options of choice, and sometimes that is about staying in the same place, but sometimes it maybe actually needs to move somewhere fresh, different reasons. But we're not in a housing emergency in Aberdeenshire, and that does help because we're able to meet these needs a little bit more flexibly than we may be able to do so in other areas in Scotland at the moment. So having that flexibility, but also recognising the priority that should be afforded to these clients does make a difference.
Thank you.
Thank you very much. Jim, please.
Thank you, Chair. Ali will be cognisant of the legislation recently passed by the last government in terms of the promise, which has made some additional commitments in terms of privatisation for housing for care experience young people getting into through care and aftercare situations. Sure, sort of take in terms of how that's going to impact and affect sort of our position here. It feels to me that it's putting an extra level of privatisation for a particular group, which is very audible in isolation, but alongside, for example, housing first or other demands there are in terms of the provision that we have.
I think our view is that we can accommodate this within this existing approach, and it's really as a result of this approach being well resourced and being successful today. Although in an ideal world we would like to have, for example, another hostel where we could help to accommodate looked after children. In practice, we have to use different solutions and different options in terms of accommodation. But we do feel that what we've seen in terms of the legislation and what that means in terms of our practice, I think we're already able to meet that, and we're taking a lot of that forward already. So I don't see it being particularly too impactful in terms of from a housing aspect. Clearly, the level of support that might be required from different services that may be a different response, but from an accommodation perspective and as part of our Housing First programme, do you feel that's something we can manage?
Okay, John. Oh, sorry, Jim. Sorry, Jim, did you want to come back?
No, fine, thank you.
Okay, sorry, thank you, John.
Yeah, Ali, just in light of the earlier discussion about information sharing, is it the case that the support is all within your own service, so there's not an issue about information sharing, or are there other agencies involved, and how do you overcome that information sharing, or is it still an issue? Thanks.
It's not been too much of a challenge, John. There's good collaboration at that local level between the teams. There is support provided directly by our Housing First team, but of course there will be other support involved with our clients. But we do have existing arrangements in place in terms of to share information. So that is working well, and we've got the resources around it. So there's no barriers that I'm aware of at this point in time.
Okay, that's interesting. So, I mean, in some ways, that's indicating what the boundaries are about the problem. You know, where it can be shared and where we run into difficulties. Okay, thank you.
And there's another example. I visited someone in their tenancy. They've been supported by Housing First in the past, and they were very positive about the experience that they had, because he was able to have got back to a position where he was being reconnected with his children. the family had separated, but because of the support he received, he was then able to reconnect with his children, and he subsequently got a tenancy much closer to where they lived, and it helped to reunite that family unit. So again, just another example of how this works as well. So there are lots of different benefits, I believe, from the project, and again, it's seen as fairly well sector leading, I think, Ali, is it not, in Scotland?
Yes, absolutely. Our teams in Aberdeenshire do lead on the National Rural Network for Housing First. I think that's been morphed into a National Housing First network. And so the model that we do in Aberdeenshire is certainly something that a number of local authorities now in Scotland have adopted, particularly since the advent of rapid rehousing transition plans a few years ago. And it's very much seen as best practice.
Yeah. Thank you for that. Any other comments or any other questions for Ali? As I say, Finlay has circulated the slides, so you should have those. But if anybody wants any more information, I'm sure Ali would be happy to have a conversation. Sorry, somebody wants to come in.
Sorry, Chair, just a quick observation in terms of the Ask and Act sort of implications, I suppose, for all of us as public sector organisations, because we could all be presented with that scenario where someone does present this to us. So that is, I know there's a bit of work that's sort of going on across all local authorities, but any idea in terms of what that would look like in Aberdeenshire in terms of, I'm thinking of Joe PC on the street that gets presented with someone that's potentially going to be homeless, and what that easy flow chart for a PC to understand about what that would have.
Yeah, we need to make it as simple as possible.
Please.
Yeah. So the plan at the moment is to have a simpler referral or online form. Just goes through to us and we can pick up from there. So we'll do this. We're happy to go on training and a flow chart. Exactly what you get.
Thank you, Chair.
So, and that would be, can you circulate that to all partners, Ali?
Yes, absolutely, and we'll do that once it's prepared.
Yep, thank you very much indeed. Thank you, Jason. No other comments, folks? Happy to move on. But again, I think if anyone wishes to follow up, I'm sure Ali would be more than happy to have a conversation with you, because it is through the bill, it's everyone's business, and everyone has to be cognizant of their responsibilities and obligations under the Act. So I'm sure Ali would be able to help with it if anyone wishes to follow up. Okay, thank you very much indeed. And that then takes us back to item 10 on the agenda. And thank you for your patience, Shantini. And this report from NHS Grampian as a population health organisation. There are some attachments to the original report. So this is being presented to us by Shantini, and it does describe, as I say, it is with respect to NHSG being a population health organisation. So Shantini, I'll just hand over to you. Thank you.
That's great. Thank you, Chair. So I'd like to use this item to briefly introduce the concept of the NHS as a population health organisation, and then what that means for how we work with community planning. So at its core, the population health organisation is about a shift for the NHS from being primarily focused on treatment to working as part of a whole system to improve population health, prevent illness and reduce inequalities. So the approach is a key part of the National Service Renewal Agenda, which is asking the NHS to work differently, much more collaboratively with partners, and much more focused on prevention and the wider determinants of health, and very much then aligned to the community planning agenda. And in Aberdeenshire, this aligns really strongly with the place-based approach that we've already been talking about taking here. So we see community planning partnerships as central to delivering this whole system approach in practice. So I also want to take this opportunity then to be very clear about NHS Grampian's commitment to community planning, and this is also reflected in our priorities for 26-27, where prevention, tackling inequalities and working in partnership are key areas of focus. And we recognise that we cannot achieve these ambitions as a single organisation, and this has to be done through strong collaborative place-based working. And this very much then aligns with the conversation we were having earlier around you know, our contributions beyond the finances to keep, you know, for the administration of the community planning, etc. So to support this shift then, a population health organisation maturity matrix has been developed, and is, in essence, this is a practical tool that helps organisations and, more importantly, systems to understand where we are now and where we need to go. And it focuses on areas such as understanding population need, which is very much aligned to the conversation we were having earlier today around data and data sharing, etc., to help us with understanding that need, working in a system-focused and collaborative way, and strengthening our focus on prevention and the wider determinants of health. So what's particularly helpful is that this tool can be applied through a place-based lens, which will then allow us to explore together how we can strengthen both the NHS's contribution to community planning and then a wider partnership working as well. So the ask today it's really more of an offer, really. So we're offering to work with the exec and community planning to use the maturity matrix as a shared learning exercise and ground that in place-based planning. And if there's support for that approach, then we would propose to run a small number of focused workshops, align these to the CPP priority areas, involve partners across the system, and then use those sessions to identify practical opportunities to strengthen how we work together. And we can then bring that learning back to this board to inform next steps. So I'll pause there and I'd really welcome your views on whether this is something the board would support, and how, and if so, then how best we might take it forward. Thank you.
Thank you very much indeed, Shantini, and invite members now to make any comments or observations, please. Jim, please.
Thanks, Chair. I mean, I think it's really welcome to see this, but I sort of declare some interest in terms of having sort of seen this through the Population Health Alliance, and also we work with Public Health Scotland on this as well in terms of the genesis of it. I think as Shantini reflected and reflect on our conversation thus far this afternoon, in some respects, it's not dissimilar to what we are striving to do and seek to do already in terms of using an evidence-based approach and in terms of focusing together on the areas of priority to reduce risk and harm across our communities. That's what it's just doing. I think what is welcome here, just positive here, is showing a framework and a system that can better enhance and improve organisations to do that in a more effective way. So I really look forward to seeing the learning coming from NHS Grampian, sort of taking this approach, and think that it'll be something for us organisationally, collectively, to be able to learn in terms of that better answer and focus. It can sometimes feel as though here is another framework, another model to adopt and use. I would share that portion, and yet I think this is quite accessible and elegant. Maybe it's a bit of a menu here as well, whereby we would be able to choose aspects of it to use, but it's not necessarily an all or nothing approach in that respect. So I think, it does seem to reflect and align in terms of what we're seeking to do as a CPP, in terms of partnerships, and where there's benefit for individual or collective organisations to use some or all of the framework. I think there's some great learnings coming from the NHS Grampian colleagues. Thank you.
Thank you very much indeed for those observations and comments. Shantini, is there anything there that you want to come back with?
No, just welcome the comment and the endorsement, really, of the you know, of what we're trying to do with it. I agree. I think it is a real opportunity for us. I don't think that this is another thing. I think it's just doing what we're, you know, trying to enhance what we're trying to do already. So you know, just to mitigate if there are any concerns about trying to add another thing to what we already have to do.
Sorry, John, please.
Yeah, thank you. And try and keep both hats on here, because in terms of supporting the kind of population health perspective, having a committee on this in NHS Grampian is to try and get traction for that cross-system work and the prevention side of things. As we all understand, there was a very strong drive to hit targets in hospitals, etc. And what the population health aspect is trying to do is say equally important, and in the long run, probably more important, is getting sustainability across the system. So I think through this work, trying to reach into the CPPs is trying to be a step for NHS and NHS Grampian to actually live the talk about the prevention side. So you'd expect me to kind of support it with my other hat on, but I do think it's an important area for within NHS Grampian as well, to see that it can work more effectively with partners, because that'll change will help to change the priorities within that organisation and across the system. So it's maybe a bit cumbersome, but it's trying to support how I think NHS Grampian knows it needs to move on from sucking everything into treatment and do this alongside that. Thank you.
That's very helpful and assuring, John. Thank you very much indeed for that. I think it is, well, to me, it does demonstrate that attempt to shift into that place planning agenda arena. So again, Shantini, just welcome your paper and the approach that you set out. So thank you for that. I don't see any other indications. Sorry,
Chair.
Jason.
I'll jump in. So one of the things I was considering there, Shantini, in terms of as we evolve the approach to place in the coming months, whether or not there's the opportunity then for you to be plugged in and say what tangibly, what does that actually look like in place plans, and how do we incorporate that into the place plans? So that there is definitely the opportunity to work and coalesce around that. That makes sense.
Yeah, no, that makes sense. Thanks, Jason. So I wondered, Chair, then, if I may, so perhaps, Jason, then we can connect and then work out how we take this forward in a practical way. Yeah.
So that, if it's okay, Chair, we'll add that to the agenda, if that's okay for.
Yes, of course, absolutely.
Just to have a conversation around that.
Yeah, most welcome. Thank you very much. Thank you. So I don't see any other indications. I don't hear anyone else that wishes to come in. So there are recommendations at 1.2 of the report to note the concept and model for the NHS as a population health organisation, which is set out in Appendix 1. To note the alignment between CPP and NHS Grampian strategic priorities and the commitment to continue improving how we work as a whole system, which is Appendix 2. To note the proposed actions during 26-27, particularly in relation to domains 1, 2 and 4, where these include working with community planning partnerships, which is set out in Appendix 3, and consider working through the maturity matrix assessment in relation to domains 1, 2 and 4, understanding the needs of the population, system-focused and collaborative, prevention and tackling social detriments, to understand the baseline position and how we can strengthen partnership working in relation to taking a whole system approach for community planning. So with that, colleagues, can we agree those recommendations? And again, thank you, Shantini, for your paper. And that's agreed. Okay, thank you very much. That does conclude business for today, colleagues, and I would just like to thank you all very much for attending and for all the presentations and the reports that we've considered today. Before we close, I would like just to ask us to send our good wishes to Councillor Bailey, who's not with us today. Councillor George is here in his stead. Councillor Bailey's unwell at the moment, so I'd just like to send our collective best wishes for a full recovery. Perhaps Councillor Reynolds would pass that on if that's okay, Glenn. Thank you.
Yes, thank you very much for that, Anne.
No, thank you very much. And so, colleagues, that does bring us to the end of our meeting today. The next time we meet will be the 16th of September. So in the meantime, can I wish you a very happy and sunny summer, and we shall see you collectively in September. So thank you all very much indeed. And thank you very much for attending, those of you, Anne, and I know that one of your colleagues has been on the call as well. So thank you very much, as always, for your support and guidance, and I'm sure we'll catch up very soon again. But thank you all very much indeed. Thank you.
Thanks, Anne. Cheers.
Thanks,
Thank
Anne.
you.
Thank you, Chair.
Thank you.